Good evening, everyone, and welcome to tonight's Doctors of BC webinar, Getting Started with Safety, Foundations, Rights, and Roles in Your Workplace, in collaboration with Switch BC. I'll get started with the intro and housekeeping while folks transfer over from the waiting room and settle. So this session is on Zoom webinar format. Everyone's muted on entry. Please use the chat for technical difficulties and send all your questions through the Q&A so we do not miss any of them. Zoom polls will be used throughout the session, and your participation is greatly appreciated. So this webinar is CMU accredited, and your certificate along with the post-evaluation link will be emailed to you after the event tomorrow. The survey will also pop up as you exit the webinar. The recording of this webinar will be posted on Business Corner in the coming weeks. So Switch BC will also return with a second CME accredited webinar on December 2nd, so watch for it on the registration page on Doctors of BC upcoming events calendar. I believe the team will also talk about it later in the webinar. I'll now pass it on to the Switch team for their introductions and go over today's topic. On to you, Brooke.
Thank you so much, Walter. Good evening, everyone. Thank you for joining us tonight for part 1 of 3 of our Community Physician Health and Safety Program accredited webinar series. My name is Brooke Haight, and I'm the project manager for the Community Physician Health and Safety Program. And I'm joined today by my colleagues, Carolina, one of our health and safety advisors, and Dawn, our administrative coordinator. I'll kindly ask that you reserve all questions to the end of the presentation today, when we will provide lots of time to discuss what we shared. If you have any questions in the meantime, please do feel free to put them in the chat, and we will be monitoring that. So Switch BC humbly and respectfully acknowledges the unceded lands of approximately 200 distinct First Nations in British Columbia. We further acknowledge the profound harms of colonization on First Nations, Métis, and Inuit peoples, as well as the ongoing intergenerational trauma people are living with today. In our work and in our lives, we are committed to listening and learning, to truth and reconciliation, and to finding better ways of being on this land. The Community Physician Health and Safety Program is an initiative funded by the Doctors of BC and Ministry of Health via the Physician Master Agreement. The content presented today is aligned with current occupational health and safety regulations in British Columbia and is unbiased. We are pleased to share that this webinar is accredited and that you may claim a maximum of 1 hour of MOC Section 1 credits or 1 Main Pro Plus certified activity credit for tonight's participation. Here are the learning objectives for our 3-part webinar series. Tonight is the first of this series. Over the next 3 webinars, we will describe the core components of a community medical clinic's workplace health and safety program, including legal responsibilities, roles, and regulatory requirements. And we will identify common community medical clinic workplace hazards and discuss appropriate procedures for risk management, emergency response, incident reporting, and first aid. Okay, so let's get started. Who are we? Switch BC is an independent, not-for-profit organization dedicated to health, safety, and well-being of everyone working in healthcare across British Columbia. Our mission is to support province-wide innovation, prevention, and training, and to promote a culture of safety in all healthcare workplaces. We collaborate with a wide range of partners, including unions, physicians, employers, WorkSafe BC, and the Ministry of Health. Why is this work needed? The stark reality is that both physical and psychological injury rates in healthcare are increasing year after year. In fact, injuries in healthcare are twice as high as the provincial average. Healthcare workers face more risks on the job than even police officers. This is why this work is so important and why we are here today. Switch BC has multiple program streams, but tonight we will focus on our program, the Community Physician Health and Safety Program, or what we refer to as the CPHS program. We focus specifically on the unique needs of community clinics, offering tailored tools, resources, and support to help create a safer, healthier workplace for physicians, medical office staff, and the care team. However, we are not doing this alone, and we are very grateful to our partners in this work. With support from Doctors of BC and the Ministry of Health, physicians and healthcare workers are leading meaningful change. Healthcare is deeply rewarding, but also demanding, high pressure, and at times unsafe. By sharing their real-world experiences, physicians and medical office staff are helping shape safer, more supportive workplaces. As their advocate, Doctors of BC, the Ministry of Health, and Switch BC help turn their insight into action and change. As a bit of background, in 2019, Doctors of BC, the Ministry of Health, and the health authorities signed a memorandum of agreement on physician physical and psychological safety. These efforts were expanded and renewed in the 2022 Physician Master Agreement to include continued work in health regions and work on violence prevention training implementation. What we'll focus on today is the new occupational health and safety supports for community physicians, which is where our program fits in. Here's a look at our program oversight group that guides our work. It is comprised of 3 Doctors of BC representatives and 3 Ministry of Health representatives. During the development of the program, we were also supported by a task group of physicians from around the province who provided insight and direction into what was needed in community clinics. So I just want to pause here for a second and launch our first poll. So I'm just going to ask you, have you heard of Switch BC's Community Physician Health and Safety Program before this evening? I'll just give about 30 seconds for this quick poll. Okay. Okay, so I see 68% said no and 32% said yes. Thank you for answering that. So I am going to introduce you to the Community Physician Health and Safety Program next. And tonight we do hope to provide a strong foundation of occupational health and safety knowledge, including what our program entails and what resources we can provide you. So the Community Physician Health and Safety Program is a province-wide program developed to support community physicians and their staff in meeting their occupational health and safety obligations, including psychological and physical safety, violence prevention, and the creation of safe, healthy work environments. We recognize that time and resources are often limited in community clinics. That is why this program was designed not only to meet requirements, but also to reduce the administrative burden that often comes with building a health and safety program. The goal is to make it easier for clinics to stay compliant so that physicians and staff can focus more of their time and energy on patient care. 2 of the main supports that we currently offer to community physicians and their teams are our health and safety web portal and clinic assessments. Our web portal is a central place for all the tools, templates, and step-by-step resources needed to build a complete health and safety program for your clinic. It is easy to navigate and created specifically for community clinic use so that you don't need to look anywhere else. Our webinars, including tonight's, are designed to walk you through this portal, the OHS requirements, and all the resources available to you. Our clinic assessments take this support one step further by allowing our team to help customize and tailor health and safety recommendations for your clinic. One of our health and safety advisors, like Carolina here, will visit your clinic in person, conduct a walkthrough of the space, and provide tailored, actionable recommendations based on the clinic's specific layouts and needs. This approach is supportive and non-judgmental, and many clinics have shared how valuable this in-person support has been. We highly suggest taking advantage of this service to cut back on the time needed to determine your clinic's health and safety needs. Regardless of the solution, our program is free, voluntary, and confidential, and approaches health and safety from a supportive lens. So I'm going to quickly pause here again and ask you to answer this question in the chat. So you can just type your responses in. So what topics do you think fall under occupational health and safety in a community-based clinic? Please feel free to add any answers you might have in the chat now. Okay, I see some coming in. Violence prevention. Psychological safety. Ergonomics. Bullying and harassment. verbal abuse by clients, emergency procedures, emotional safety, needle stick injuries, safe working conditions. Yes, great. Feel free to keep adding those responses in the chat if you wish as I move forward here, but you are completely on the right track. Most of these topics that were listed in the chat here are topics that we specifically have on the web portal, including supportive resources. So on the right-hand side of this slide here, you will see a comprehensive list of provincially regulated occupational health and safety topics that we do cover. That being said, we are also available for virtual or on-the-phone consultations for any occupational health and safety matters. This includes both urgent and non-urgent matters. All contact information can be found on our web portal, which I'm going to show you next. So this is our Community Physician Health and Safety web portal. It's a one-stop shop with everything needed to build and maintain a health and safety program. The portal is interactive with easy-to-use checklists, templates, learning tools, and progress tracking so clinics can work at their own pace. If you participate in an assessment, the report you will receive will include links to our portal to help you implement recommendations. You can visit the portal at any time to work through the content. We're just going to paste the link in the chat now for your convenience too, so that you can look at the portal afterwards. Here's a screenshot of the web portal's homepage. At the top right, you will see two main tabs. You do not need to create an account to use the portal, but we do suggest doing so as it allows for additional features such as progress tracking, multiple members of a clinic working on content together, and a certificate of completion once all modules have been completed. The clinic assessments tab, number 2 there, is where you can go to book one of our in-person clinic visits. The first step is to book a discovery meeting, which is a 20-minute virtual call with an advisor to get to know your clinic and what we can offer you. As next steps after tonight's webinar, I encourage you to 1, make an account on our web portal, and 2, to book a clinic assessment discovery meeting so that as early as tomorrow, we can start helping to reduce the administrative burden in your clinic. This is what you'll see when you go into the Build Your Program tab, and it is where all of our health and safety resources are housed, including that list of provincially regulated topics I showed before. So tonight, we're going to start walking you through these topics so that you have a clear picture of requirements and where we can help. Here are the topics we're going to cover this evening. We're going to talk about WorkSafe BC registration, health and safety program overview, roles, rights, and responsibilities, health and safety meetings, worker representatives and joint occupational health and safety committees, and young and new worker orientation. So I'm now going to pass it over to Carolina, who's going to start us off with a discussion on WorkSafe BC registration.
Thanks, Brooke. Yes, so before we look at the details of health and safety program for your clinic, I will start by talking about WorkSafe BC registration. The learning objectives of these sections are to define the purpose of WorkSafe BC registration, explaining why it's important, and to list the registration requirements for community-based physicians. So let's start with when a community physician is required to register with WorkSafe. So all employers in BC must register with WorkSafe and pay premiums to make sure their workers are covered if they get hurt or sick because of their work. It's not an optional benefit. Every employer is legally required to register and every worker must be insured. For community physicians, this means that if you hire anyone, like an MOA or other clinic staff, you are considered an employer. So whether you run the clinic on your own, directly employing people, or through a medical corporation that hires people, you need to register with WorkSafe BC to provide that coverage to your staff. And why is registering important? Because it protects both you and your staff. First, it ensures your staff are covered if they get injured or become ill because of their work. In this case, their medical treatment, rehabilitation, wage loss benefits will all be taken care of. It also protects you. If your employee is covered, it protects you from lawsuits and from having to pay those costs yourself. And finally, registering with WorkSafe helps you avoid paying premiums later if WorkSafe BC finds you should have been registered and you are not. For example, if WorkSafe PC becomes aware that an employed worker is not covered by the insurance, they can charge the employer for past premiums. So, okay, we talked about staff coverage, but what about WorkSafe BC insurance coverage for community physicians themselves? Well, physicians who are employers can also be covered by WorkSafe for both income and medical costs coming from work-related injuries or illnesses. If you are a physician who is a shareholder of a medical corporation, you are considered a worker of that corporation. And WorkSafe BC coverage applies to everyone who works for that corporation that is registered, including yourself. So if you are registered your corporation with WorkSafe, you will be covered. If you're not incorporated and work solo, you can apply for POP, that's optional personal coverage. So in both situations, corporated and incorporated physicians, it's possible to be covered by WorkSafe. And if you get injured or become ill because of your work, you can have your medical costs and income loss paid. So how to register with WorkSafe? To register, you will find a link to the physician-specific registration form on our program web portal. You can access our portal page by scanning the QR code on this slide or visiting the link shared on the chat, the cphs.switchbc.ca. If you'd like more information, you can visit Doctors of BC website to view the guide and the video they developed with WorkSafe, which focus specifically on physician registration. And we will share the link on the chat. Now that you know when and why you need to register with WorkSafe, I will pass it on to Dawn to start talking about the Occupational Health and Safety program for your clinic.
Thanks so much, Carolina. Yeah, we can go to learning objectives. So today we're going to identify the key components of a workplace health and safety program, and then also be able to describe how these components contribute to a safe and compliant work environment. So every workplace, even small businesses, must have a health and safety program to help prevent work-related injuries and illnesses. What does a health and safety program do? It's a program that helps employers keep workplaces safe by managing tasks, sharing clear safety rules with staff, and setting goals to improve safety. It also assigns roles and responsibilities to ensure tasks are done right. This results in reducing injuries and costs from missed work or disabilities. So what are the benefits? So what are the elements of a health and safety program? All programs need to include a few key components. This includes regular safety meetings and inspections, clear written procedures, and training to help workers stay safe on the job. It should also have a system for reporting and investigating incidents and proper first aid supplies and support in place. In addition to these basics, the program should also include elements for the specific workplace risks. For example, in medical clinics, a violence prevention program is required because workplace violence is a known hazard. Even though WorkSafe BC classifies community physician and specialist clinics as low-risk workplaces for occupational injuries, the daily pace and variety of work means risks are real. Setting up consistent safety discussions, whether it's a quick monthly check-in or more formal reviews, helps keep teams connected, aware, and proactive. The key elements of a health and safety program that are listed here are supported by modules that include tools and templates on our web portal too. You will not have to search various resources to help make implementation straightforward and efficient. Our web portal has it all in one location. The written policy formalizes your clinic's commitment to protecting staff and patients. When it is current and endorsed by leadership, it signals that safety is not simply a compliance exercise, but a core part of how the clinic operates. It reinforces accountability and a shared commitment to safety. For workplaces with 50 and more workers, this health and safety policy is required. For workplaces with less than 50 workers, the policy is recommended as best practice. The good news is, again, You do not have to create it from scratch. The downloadable one-page template is available on the CPHS web portal to help you get going right away. All you have to do is fill in the clinic name, get employer sign-off, and date it. Afterwards, share it in a location where staff or workers can easily view the policy. So here's a quick glance at the one-pager template for you to download, fill in, and put right to use. You can take a look at it right here. So we have a poll question, which Walter is going to pull up for us. From your experience, which areas of health and safety tend to be the most overlooked in busy clinical settings? So there's no right or wrong answers, and it's opinion-based, and you can feel free to select more than one. Oh, we still have a few more coming in. Okay, thank you for sharing. So creating a health and safety program does indeed require time and resources. But we hope that the web portal with its tools and templates assists in efficient creation and implementation of your clinic's required health and safety program. Now that we have covered the foundation of the health and safety program, I'm going to pass it over to Carolina to walk us through how it comes to life through the defined roles, rights, and responsibilities of the employers, supervisors, and workers.
Thanks, Dawn. So next slide. Yeah, in this section, we will describe the legal responsibilities of workers, supervisors, and employers, the workers' legal rights, and we will also see the difference between the rights and responsibilities to understand how they are important to maintain workplace health and safety. So on this slide, I know it's quite wordy, but the main legal responsibilities are highlighted, and I will explain what each role must do to comply with the regulations. First, I will explain about employers. Employers are responsible legally for keeping the workplace safe for everyone, not only safe for their employees, but also for all people working in the workplace. To ensure the workplace is safe, employers have to look for existing hazards and fix anything that's unsafe there. Employers also need to develop safe work procedures and need to provide protective equipment, information, instructions, and training to ensure workers do their job safely. For example, in a medical clinic, a common hazard is workplace violence. That means that the employer, which can either be a single doctor who hires their own staff or a group of doctors who run the clinic together, the physician employer is legally responsible for assessing the risk of violence in their clinic and implementing some controls measures to mitigate the risks. The physician employer must also instruct and train their staff on how to recognize the risks of violence and how to respond to violent incidents in the clinic. Now let's move to supervisors. What are their responsibilities? Supervisors protect the team. They should know all the safety rules and lead by example. They must ensure workers understand the existing risks, follow all safety procedures, and that the workers use the controls provided. For the example of workplace violence I just shared, the supervisor would be responsible for making sure staff are aware of the risks, know how to respond to violent incidents, and that they follow the established safety procedures. And what are the legal responsibilities of workers? Workers must work safely. This includes staying fit for work, free from alcohol or drugs, and following all safety procedures. They must use personal protective equipment and other controls methods provided. They should also report any hazards or if they notice to their supervisor. Workers also have legal rights, including the right to refuse unsafe work, the right to be informed about existing hazards, and the right to participate in safety activities. And it's important to mention that it's employers' duty to ensure workers are aware of these three rights. So in summary, employers, supervisors, and workers all have legal responsibilities. Workers also have legal rights. And these responsibilities and rights work together. Like workers depend on their supervisors and employers to provide a safe workplace and to provide information they need to work safely. And while employers and supervisors depend on workers to follow the safety procedures and use the control methods provided. And when everyone does their part, the workplace becomes safer for everyone. So let's do a quick check-in on roles and responsibilities. Here's a question for you. Which of the following correctly matches each role with its main responsibilities? It takes some time for you to read and choose. Okay, it's supposed to be easy. Correct. It's A. In short, just to stick in mind, employers provide, supervisors ensure, and workers follow safety rules. Now I pass it on to Dawn, who will discuss an essential component of every health and safety program, which is safety meetings.
Thanks so much, Carolina. So we're gonna take a look at the learning objectives. So first off is to explain the purpose and structure of health and safety meetings, and then to be able to summarize how these regular meetings support workplace safety improvements and regulatory compliance. Health and safety meetings are a required part of every workplace, including medical clinics. They give physicians and staff a chance to openly discuss safety concerns, share ideas, and resolve issues. These meetings must take place once a month and should stay focused on prevention. This includes identifying and correcting unsafe conditions and practices. It is also important to document what was discussed and what actions were agreed on. Regular health and safety meetings help keep communication open and everyone accountable for maintaining a safe workplace. For clinics with less than 10 workers, all workers should join the monthly safety meetings. In clinics with 10 to 19 workers, one health and safety representative can be selected and speak on behalf of the team during monthly meetings. Larger clinics with 20 or more staff must have a joint occupational health and safety committee, where at least 2 worker and 2 employer representatives meet monthly to review safety activities and concerns. These consistent meetings do more than meet WorkSafe BC requirements. They strengthen teamwork, encourage early problem identifying and solving, and to help ensure that safety remains an ongoing shared priority across your clinic. Health and safety meeting minutes must be kept, and it is required that records be retained for at least 2 years. Again, our web portal includes a template for your health and safety meeting agenda and also minutes that you can download and fill in digitally. It is essential that health and safety meeting minutes are kept, as this is a legal requirement, and records can be retained for at least 2 years. Keeping these records help ensure compliance and supports a safer workplace for everyone. We have another poll question, which Walter is going to launch. In your experience, what is the greatest challenge to holding regular health and safety meetings in clinical settings? Again, there's no right or wrong answer and is based on your opinion. Feel free to select multiple answers. Thank you. It looks like we have 2 top ones. One is competing priorities in a busy clinic environment, and also finding time that works for all staff. So thank you for your input. It's clear that holding regular health and safety meetings in clinical settings comes with real challenges, whether it is scheduling, participation, documentation, or competing priorities. These are common barriers across clinical environments. That said, these meetings remain a key component of maintaining a safe and compliant practice. To make this process more efficient, there's 2 things. Visit our web portal for streamlined tools, templates, and practical resources to help you get started or to clarify any components in your current health and safety meetings. And number 2, book a clinic assessment to access the complimentary support of a health and safety advisor for a tailored consultation. Even small, consistent efforts can improve safety outcomes and reduce risk over time. I'm going to pass it back to Carolina to explore the topic of what is a worker representative and the details on a joint occupational health and safety committee.
Thanks, Dawn. Yes, I'll explain about the importance of a worker representative and of a joint occupational health and safety committee. So as I said earlier in this presentation, one of the rights that workers have is the right to participate, which means to be involved in health and safety matters of the workplace. That's why this topic is important, because the law requires that workers have a voice in safety discussions and take part in health and safety practices. So in these sections, we will define the roles and functions of a worker rep and a joint committee member, and illustrate how they participate in the clinic's health and safety program. So first, let's start with when it's required to have a worker rep or joint committee. Well, if the clinic has less than 10 workers, no worker representative is required. In such small workplaces, it's usually easier for everyone to share their safety concerns directly with the employer and take part in health and safety discussions. If the clinic has 10 to 19 workers, a worker rep is required, and they should ideally be elected by the workers. And if the clinic has 20 or more workers, a joint committee should be established, and the committee must have at least 2 worker reps, also selected by workers. Important to note that for this specific regulation, only staff directly employed by clinics should count. So contract physicians, medical residents, locum physicians, PCN professionals, and other people working as contractors can be excluded. So what do the worker rep or joint committee members do? So they have the same functions and duties, so I've explained them together. They should participate in health and safety matters discussions. They should take part in regular inspections. They can make recommendations for safety improvements to the employer to make the clinic a safer space. They should participate in incident investigations, and they can advise on workplace or equipment changes that could improve safety for staff. Just important to share that if your clinic is required to have a joint committee, you must develop a set of rules of procedures in writing for your committee. And to facilitate that, our program created a template for the committee's terms of reference that you can use for free accessing our web portal. You can find this. If you scan the QR code, you go to our web portal where you'll find this and other ready-to-use templates we created for community physician clinics. Another legal requirement is that both worker rep and committee members must receive training to learn how to perform their roles. And on our web portal, you will also find links to free online training courses. So let's do a quick check. Yeah, the pool's there. So here's the question. What are the main responsibilities of a worker representative or joint occupational health and safety committee member? To give some time for you guys to think. Perfect. Thanks for the responses. Correct. It's letter A. So the worker rep and joint committee main responsibility is to participate in health and safety matters. So they spot and report hazards, suggest improvements, and take part in inspections and incident investigations. Very good. So I pass it on to Brooke to continue our topic presentation.
Thanks, Carolina. So that brings us to our final topic of the night before we get to questions and answers, which is young and new worker orientation. So throughout this topic, we will identify the specific orientation requirements for young and new workers, as well as explain the employer's obligation to provide training, supervision, and monitoring for these workers. So who is a young or new worker, and why are these requirements specific to them? A young worker is anyone under the age of 25, and a new worker is anyone, any age, who is either new to the workplace, returning to the workplace after hazards have changed, or relocating to a new workplace with different hazards. For community physicians, this may include any staff new to your clinic, students in placements, and new medical office staff graduates. So I'm going to launch the sixth poll, or Walter will here. Why do you think it is important to ensure young and new workers are properly trained? Okay, thank you. So the correct answer is E, all of the above. Thank you for that. So it's important to ensure young and new workers are properly trained because, as you remember, probably from yourself, as starting out in a new position, young and new workers have unique needs that include inexperience, lack of training, potential misunderstanding of their role, and hesitancy to ask questions. These unique needs all pose as risks to their health and safety that need to be addressed by the physician employer. So physician employers are required to provide young or new workers with workplace training and orientation to address these risks. On the left hand of the slide, I've included what is required by WorkSafeBee as part of this orientation. For example, you must orient them to any potential hazards they may face at work, violence prevention policies, use of personal protective equipment, WMIS information relevant to the workplace, and emergency procedures, just to list a few. This full list of topics can be found on our web portal under the Young and New Worker topic. This is also where you can find our Young and New Worker Orientation Checklist, which is a requirement of physician employers and shown on the right hand of the slide here. This checklist was designed by the program as an easy-to-use tool to ensure that all orientation requirements on the left are met. It can be saved as a PDF or printed based on your clinic's needs. So that brings us close to the end of our presentation. Thank you all for your attention and attendance this evening. As a reminder, the topics on the left-hand side of the Build Your Program page on our web portal cover the occupational health and safety legal requirements for community-based medical clinics. We covered 7 of these topics tonight. We have 2 more upcoming webinars covering highly relevant and timely topics that are critical in healthcare settings, including violence prevention, bullying and harassment, and emergency preparedness. These sessions are designed to address the challenges that many clinics face on a daily basis and provide practical strategies that can be applied immediately. We encourage you to attend the next 2 webinars on December 2nd and February 10th, where we will continue to walk through Community Physician Health and Safety Program and how we can support you in meeting these health and safety requirements for your clinic. We will also add these registration links in the chat now if you wanted to register as early as today. So next steps after this evening's presentation is to start the clinic assessment process by booking a brief virtual discovery meeting. I've added a QR code here that will take you directly to our booking page. As a reminder, the clinic assessments are free, voluntary, and confidential and will reduce time spent searching on what needs to be done at your clinic. Tailored recommendations and ongoing support will be provided. I would now like to open the floor for any questions, and also feel free to type them in the chat as well, and we will be monitoring that. Thank you.
So, Brooke, there are 2 questions already on the Q&A. And I was checking them. May I answer the first one?
Of course, yeah.
Yeah, so someone is asking, do you register with WorkSafe if you are incorporated but work in the clinical part and not involved in hiring staff? So yes, incorporated physicians must register with WorkSafe BC. and the corporation will hire staff. But yes, corporated physicians should be registered. The corporation should be registered. And even if you are not directly involved with the hiring staff, the corporation will. And another way of looking, if you receive the only T4A statement, you don't have, it's not required to register. Or if you work directly with a health authority and have a salary agreement, but otherwise you should register with WorkSafe. The second question I could not understand clearly, so if the person could explain a little better, it says, do you have claim with WorkSafe if you can't work because of inability of staff? So yes, if you could please explain further this question, I would appreciate it. What I can say that if the staff has any injury or illness due to work, the employer should register report to WorkSafe PC, the injury and illness through a form. We have this on the portal. So within 3 days of being with acknowledging the injury or illness. So yes, employer need to report to WorkSafe BC if one of their staff is injured or ill because of work. If it's illness, sometimes the illness is kind of take time to develop, but it should be reported within 3 days after the employer is aware of the illness. So yes, the employer need to report to WorkSafe BC every time a worker is injured or ill because of their work. I don't know if I could answer properly, but if you're free to explain a little better your doubt or your question if it was not clear.
Okay. Thank you, Carolina. I also just wanted to note that we are always available for questions and concerns related to your clinic's occupational health and safety. So at any time you can email us. That email is on the bottom there. And additionally, all of our contact information is on our web portal, including our phone line. So if you would rather talk to us over the phone, please do feel free to do so. We can take urgent and not urgent requests. Just pause quickly here if there's any last questions before moving on. Okay, thank you, everybody. So thank you for attending tonight's webinar. Before leaving or as you leave, just please take a moment to fill out the short evaluation form. Your feedback helps us to improve the future sessions. We will put that link in the chat as well, and feel free to use the QR code if you prefer. So thank you so much, everybody, and we hope to see you at the next webinar on December 2nd. Thank you.